innate immune system. So what are these types? So if we use the right stain and we stain the cells, we find 3 types of cells. Cells which do not stain with the polymorphonuclear shape or neutrophils. Cells which stain blue. So this dude over here, he's staining blue. I've put one leg is M and the other leg is B. So this is mast cell or basophils. They're basophils because they're blue, and they're blue because they have granules in them which contain histamine and those things which are charged in a way that they would pick up the blue stain from the eosinophil, I believe. Now this is a, hematoxylin. Now this is eosinophil. They are red. They have major basic protein in their granules. Major basic proteins attract the eosinophils. They are oppositely charged. So eosinophils, the basophils, the neutrophils, they're white blood cells, and they are also part of the innate arm of the immune system. So coming out of the bone marrow, we have now 4 effectors. We have 4 soldiers who are sitting there and who are attacking the pathogens. Neutrophil, you'll find out, one of the most important part of the inflammation and part of the immune system. Now remember, even inflammation is there to protect us. What does inflammation actually do? It increases the blood supply to a particular part of the tissue which is under threat or is getting damaged, and bring in the supplies, the cells and the protective systems and the proteins and the weapons to kill the pathogens there and then to repair the system, the tissue. So neutrophil, very, very important cells. What they have is, if you see here, they have their own little grills in there which they use to burn the pathogens. So they have their own little phagosomes and lysosomes or vacuoles which they use to attack the bacteria. So they eat up the bacteria or the pathogen and then they attack it. So neutrophil would be doing that. Now the mast cell and the basophil, these are very, very interesting and really very important from a doctor's point of view. These are the guys who cause allergic reactions. So very, very important thing. You would encounter them a lot. My own family, my son, has very common allergic reactions as well, very, very commonly allergic reactions. So what happens is the mast cells are actually basophils which are fixed in tissue. And basophils are the cells, mast cells, which are running around. So really, just like macrophages, which are monocytes which are fixed in the tissues, just like that, when a basophil goes in the tissue and sits there, then it is called a mast cell. The same thing. Mast cells have granules which have gotten histamine. And histamine, they have other granules as well, for example, peroxidases and stuff, but important thing is histamine. What happens is this: when mast cell becomes triggered, when mast cell becomes activated, it degranulates. It throws the histamine out. What does histamine do? There are 2 very important things in histamine which contribute to anaphylaxis. What are these 2 things? One, histamine causes vasodilatation. So that would cause, if it is generalized vasodilatation, that would cause edema. If it is localized vasodilatation, that would cause redness and edema and swelling of that local area, hives. The other thing is, histamine is smooth muscle contractor. So when it acts on the muscles of the respiratory system or the bronchial tree, what it causes is it causes the constriction of the trachea and bronchi. Now there are 2 problems. One is histamine has caused increased blood supply, increased secretions, so the airway is already tightening because of excess secretions. Second, the airway is constricting because of smooth muscle contractions. So, and that is what sometimes can cause death as well in the patients. So mast cell, basophil, very, very important effectors. Normally they are causing the allergic reactions. Okay, eosinophils. Eosinophils, if you see this is a nice looking dude, do you know that we actually do not know the function of the eosinophil? What we know is, again, there are many people who are doing researches and they are aware of a lot of things. From a medical textbook point of view, Eosinophils, their basic function is really not known. What we know is that they can help when we find worms in our larvae of the worms in our bloodstreams moving around. These guys can attack those. How does that attack? We'll see that IgE, an immunoglobulin, comes and gets attached to their receptors, or the IgE is actually attached to the worm. Then these guys go and attach to the IgE and then attack the worm itself. So what they do is they spill out their granules, for example, major basic protein, which goes and damages the surface of the worm and hopefully causes the worm to die. So an effector cell, really for the worms, the mast cell, basophil, an effector cell, mostly causing allergies. Neutrophil, very, very important effector cell. This is actually first line of defense, part of the first line of defense, meaning part of the acute phase of reaction to a pathogen. So acute inflammation uses neutrophil. So neutrophil comes onto that space wherever the pathogens are. They eat up the pathogens, they fry them, they break them, and they throw them out. So these are phagocytic cells, but they are not